My passion at the Gavin Herbert Eye Institute at UC Irvine is my work with the Holland Foundation for sight restoration. We are very privileged that we were selected as a beta site for this program to expand the treatment of severe ocular surface disease, ocular surface stem cell transplantation across the country, to take centers and provide that education required to treat these very complex patients. We started this project a decade ago when Ed Holland came out and trained me in this technology and really mentored me. We have been able to treat a small number of patients until recently. A year ago, we really established and expanded our program at UC Irvine, and we were able to hire a nurse transplant coordinator who's really the catalyst to making this program work, who can manage the hours and hours of complex patient care that's required around immunosuppression and the management of these complex post-surgical patients. We have now expanded from doing a handful of these a year to being able to do 100. Honestly, right now we are close to managing 70 to 100 of these patients in various different levels of complexity. Our nurse manager is able to coordinate our care so that it makes the process doable, and we're making a big difference in these patients' lives, enabling to restore their vision. These patients are corneal blind patients who are now able to restore function to their life, being able to care for themselves daily. It's made a huge impact, and I really want to thank Ed Holland and the foundation for allowing us to treat these patients here on the West Coast.